Hi, everybody. Thank you for taking time out of your day to spend a little bit of it with me. I appreciate it. Today, we are going to talk about a very common problem. My name is Dr. Ashley Woods. I'm one of the physicians here at Maxwell Clinic. And it's my pleasure to be with you. I'm going to wait just a few more minutes as other people may be jumping on. If something goes awry with this webinar, meaning a technical difficulty like internet going out, just stay on the link. I will log out, jump on my hotspot, and rejoin. If you have questions that come up as we go through the slides and the discussion today, please put them in the chat. There will be time at the end to answer questions that may come up for you. And I'm going to go ahead and get started. Again, today I'm discussing a very common problem that affects greater than 25% of Americans called acid reflux. Some people call it indigestion, or we call it GERD for short, standing for Gastroesophageal Reflux Disease. So if you've joined us today, it's likely that you or someone that you love suffers from pain or discomfort after meals. But eating should not hurt. It is a reality for many people. And it can be occasional with certain foods, or it can be with every meal. And that's unfortunate. These are some symptoms that people may complain of or that you may have. And there are many reasons that food can create problems. And I'll touch on some of the many causes today, but we're not going to do a deep dive into those. We're going to mostly be talking about acid reflux. So these symptoms, as they're listed here, burning, or what people call as heartburn or indigestion, can occur in the tummy, or it can occur in the chest, or people can have chest pain, and it can be so severe that a lot of folks may go to the emergency room because they're not sure what's happening and may think they're having a heart attack because it's that painful. Abdominal pain can happen, nausea after meals, bloating, belching, coughing, which sounds strange, but a lot of people will end up at their ear, nose, and throat, or allergist or primary care doc saying, well, I got this cough and it just won't go away. It can actually be from acid reflux. Sore throat, hoarse voice for no apparent reason could be acid reflux. And so you might leave your ear, nose, and throat doctor or your primary care doctor saying, oh, give this prescription of Prilosec a try. Let's reduce your acid and see if this gets better. Wheezing that occurs primarily at night, and a little bit of anatomy that we're going to talk about in a minute will help explain that. So these are familiar medications that are often reached for or even prescribed for these symptoms. Listed here are alkalizing agents, H2 blockers, proton pump inhibitors. Some of them used to be prescription, but now they're easily reached for over the counter. And so I really think that 25% of Americans might be a little higher because this is a very, very common medication used in America. And many work very well acutely, but they were never intended to be long-term medications. And some of them cause really big problems long-term because they lower the acidity of the stomach. And you're like, well, Dr. Woods, isn't that the point? No, that's really not the point. You don't want lower stomach acid, and that may surprise a lot of you, but it's actually a location problem. And that'll make more sense when we go through some anatomy here. This is not your anatomy. This is a photo of a complex contraption that does a simple task. And Rube Goldberg was a cartoonist and engineer who was known for drawing these types of machines. In our house, when my boys were little, we would make things in our garage out of random stuff to roll a ball down a hill to land in a cup. And we made up the name Gugemizer. which is really not a word. But this is a Guggenheimer picture or a Rube Goldberg contraption. But it reminds me of human digestion because eating food to nourish our body seems like a simple task. But digestion is really quite complex and it relies on many sequential things to happen under the hood for the desired outcome to occur, which is to get nutrients into your cells to create energy. So stick with me. Here is an anatomy picture. We're going to go through this, and you don't really have to remember or completely understand, or maybe this is really basic for a lot of folks, but I want people to understand what I'm talking about because otherwise it won't make sense. So digestion, again, like I said, is very complex. It is a process that involves over 8 organs and numerous enzymes, nerves, and hormones. And this process turns what we eat into energy or fuel for our body and brain. And more specifically, it breaks down that meal into fats, carbohydrates, proteins, vitamins, minerals, and phytonutrients, and waste products. And this whole process takes about 30 hours for it to be complete. The process is both mechanical, like chewing and churning of the stomach, and chemical with the enzymes. And it all starts actually in the brain. When you very first think of eating a food, or think about right now biting into a lemon, kind of like makes your mouth salivate a little bit. That's because the thought has triggered the release of amylase in the saliva to get your body ready for that first bite of food. It prepares yourself to be able to enjoy what you're about to eat. Next comes chewing. Chewing is something that I actually talk about with a lot of my patients because if they're having indigestion or tummy issues at all, I'm like, well, do you chew your food well? Because we live in a fast-paced, very busy society where we got to eat fast. We don't have time to sit down and, do things, especially during the week. And I am also very guilty of that, but you've got to chew your food. That is what your teeth are for. And the more you chew and the more you pulverize your food, the better it's going to do as you begin to digest. So lots of chewing and very slowly is important because that's a step you don't really want to skip. And it breaks those big molecules, pieces of meat, pieces of broccoli, whatever you're eating, into smaller food particles. And then combined with saliva, it becomes a big lump, which you swallow. That big lump is called a bolus if you're being technical. And then that bolus begins its journey down a long tube called your esophagus. And this is helped by gravity and peristalsis, which are sort of waves that are non-voluntary. It just helps the food move down. And at the end of the esophagus is a little trapdoor. We'll call it it's called the lower esophageal sphincter. I'm the one calling it a trapdoor because that's the easy way to think about it. It's closed most of the time unless food's coming down, and then it opens, and then it is supposed to close again. This is key because this is where the problem lies. So once it goes down through the esophagus, it hits the stomach. In the stomach produces hydrochloric acid. So this is where the acid piece comes in. Hydrochloric acid's pH, or the acidity of that, is a number, which is 0.8. It's very, very low. And so the acidity of the stomach is between 1 and 3. And you want it to be between 1 and 3. You don't want to lower the acid of your stomach. And for reference, water is a pH of 7, and that's neutral, and the body likes neutral. The stomach is the only organ on this whole trail that's really built for holding acid and keeping. It's lined with mucus, and the cells there are not disrupted. There are some exceptions like ulcers, and we'll talk about that later. But what I'm saying is that that's where the acidity is supposed to be and stay. And it's that little trap door at the top, or the lower esophageal sphincter, that is supposed to close and remain closed as your stomach begins to churn and pulverize, again, mechanical, churn and mix with acid as it begins to digest. further down, you get secretion of other enzymes from other organs. So the other organs kind of join the disassembly line, and then the liver, the gallbladder, the pancreas secrete their enzymes. And the secretion of those enzymes rely on the pepsin signal from the stomach to activate them. In other words, you need the acidity to have occurred for those other enzymes to come online and start helping break down the amino acids, the fats from the gallbladder. People that have had their gallbladder removed frequently will have trouble digesting fattier foods, and that can be a problem. Another thing that is important here, and this is a big reason that we need the stomach acid, is that to absorb vitamin B12. Vitamin B12 is only available if you're not supplementing through animal proteins. And so, but for you to absorb the vitamin B12 that's in that steak or hamburger or whatever you're eating, it's got to be broken off by the acid. It's got to be separated from the protein molecule, and the acid is what does that. And then you release something called intrinsic factor. Intrinsic factor is released, and it binds to the B12, and it helps the absorption further down along the trail in the terminal ileum, which is part of the small intestines. And so if you don't have the acid to break off or to break apart the proteins into smaller amino acids, and you can't break off the B12, you're not going to be able to absorb it. So lowering your acid in your stomach is a bad idea. And I know that's really what's the word I'm looking for? It's not what you're taught in school. It's not what I was taught in school. It's like, oh, high acid, treat it, lower it. And so that's going against the grain, but it serves a purpose. So after these other enzymes and organs kind of join the disassembly line of that food bolus coming down, now the food bolus is more of like what's called chyme, and chyme is more of a frothy slurry of a mixture if everything is going well. And then as it gets to the small intestines, that's where all those nutrients that you're trying to get from that plate of food that's where they get absorbed into the bloodstream so that they can be in the cells and do their thing. And so, like I said, like if you don't have a gallbladder because you had gallstones, you had removed, breaking down fat will be a problem for you. And so, again, the small intestines is where all these disassembled molecules, proteins, fats, carbs, minerals, vitamins, phytonutrients are absorbed into the bloodstream, and then your cells use those for energy. And that's kind of the whole point of why we eat. Now, I mean, we're also hungry, and it's social, and it's fun, and food is yummy, and I get all that. But on a microscopic level, that's kind of what we're doing. At the end of the small intestines is your colon, and it's a big transport tube where stool travels through until you poop. And the whole process, again, takes about 30 hours, unless you have some kind of intestinal illness or something else going on. So, like I said, eating and digestion is not simple, but it is complex. And if one thing is off, it affects everything else downstream. So what is this whole thing about acid reflux, and why do we care? Well, we care because it causes a lot of problems, but what I want to reinforce is it's the reflux piece that's the problem. It's not the acid itself. It's acid being in the wrong location, because your esophagus and your small intestines are not supposed to have acid in them. And acid will reflux up into your esophagus and create all those symptoms that we listed on the first couple of slides to occur. So this is a great picture because it shows the stomach, and it shows acid refluxing back up through that lower esophageal sphincter. Now you see this sort of band of tissue there that kind of transverses the esophagus, and that is the diaphragm. That is the big muscle that helps us breathe involuntarily 22,000 times each day without having to think about it. And so that diaphragm is allowing the esophagus to, it's the only opening in the diaphragm is the hole that the esophagus comes down and attaches to the stomach. So people that have hiatal hernia, what that is the stomach is starting to poke up into the lung cavity, not into the lung, but into the chest cavity. So that opening in the diaphragm may anatomically for some people be a little larger, and those people are going to have trouble with the trap door closing, thus some acid reflux, again, acid being in the wrong location. Other things can affect and disrupt the lower esophageal sphincter, and we're going to talk about that. So again, the big takeaway point that I really want you to understand is that your stomach acid is a critical step in processing and digesting your food. And without it, we develop nutritional deficiencies in things like amino acids and vitamins. Amino acids are important for energy production, for detox, for making our neurotransmitters. Fatty acids, they're important for cell membrane creation and maintenance. And we talked a little bit about the vitamin B12 because that's a great example of what can be thrown off by lowering your stomach acid on a everyday basis with those types of medications. So what causes lower esophageal dysfunction? Several things are listed on here. We've talked about a couple of them. Eating certain types of foods, chocolate, coffee, peppermint, sugar, onions, those are just a few. Certain people have certain foods and they know their triggers, so that's a problem. Alcohol or smoking will relax the lower esophageal sphincter or the trap door. Excess weight in the middle section, overeating, big meals, lots of medications that are pretty common. Albuterol, which is frequently used for asthma, calcium channel blockers, beta blockers, benzodiazepines, and some pain medications. Increases in intra-abdominal pressure, like if you have on really tight pants. After you eat a meal and things just don't feel right, and then you get home and you're unbuttoning your pants, oh, that feels so much better. Well, you've increased your intra-abdominal pressure. Gravity. So when you lie down at night, gravity is your friend. So if you eat and then immediately go and lie on your sofa, that's sort of working against gravity. So that affects it somewhat. Hiatal hernia we talked about, and then autonomic dysfunction mediated by the vagus nerve. So things that you can do kind of speak to this, and people who've had reflux have probably tried some of these things, like elevating the head of their bed, not eating 2 hours before dinner, losing weight, which is harder to do sometimes than others. Stop smoking. I mean, that's a little bit of a no-brainer for good health, but people struggle with that. Chewing your food well. That is like the simplest thing. And I'm guilty of not always doing it, but if I pay attention, it happens, and it's important to remind myself. And I have on here pause, relax, breathe, and gratitude before meals, because I do talk about this with my patients. Whether you say grace at the dinner table or not is not my point I'm trying to make, but the point of just that pausing and being like, taking that deep breath and settling in to be like, okay, I'm going to accept these nutrients into my body, and then you can dive into your food. And that kind of helps pause you and slow you down and help you remember to chew. So achlorhydria, and that's a big fancy medical word for not enough stomach acid. And And now this sounds crazy, but stomach acid production, low stomach acid production is a very common cause of indigestion. And a lot of people think it's because they have too much, when in fact the case is they don't have enough. And it can cause pretty significant discomfort after meals, particularly bloating and nausea. What are the causes of low stomach acid? The ones that I see, they're listed here on the slides, but I'm going to only speak mostly about the ones I see most commonly are stress. People that are stressed don't digest their food well. They also probably don't take time to chew their food well. So stress will absolutely lower your stomach acid. In fact, if you think, and what I hear a lot is that, yeah, I started having stomach acid, and when you look back, it was around the time of a lot of stress in their life, or something happened, and then after that, digestion was suddenly more of an issue. Acid blockers, Prilosec. That's why we frequently at Maxwell Clinic will try to get you off your acid blocker or your PPI as soon as possible, for this reason. Autoimmune issues, surgery can do it. Fasting, which we do actually recommend quite a lot at the Maxwell Clinic. It actually can increase your stomach, or can, sorry, I said that wrong, can lower your stomach acid, and different infections. But stress and also stomach acid goes down with age. And so that's pretty common. We see as people get older, their stomach acid will drop. Again, complicated, simple. So the consequences of low stomach acid we've talked about already. So nutritional deficiencies is sort of a broad category, but there's some specific ones listed. But one thing I didn't mention is bacterial overgrowth, of things like H. pylori, which can cause stomach ulcers, fungal overgrowth. So the potential clinical outcomes: depression, anxiety, if you don't have the building blocks for neurotransmitters, brain fog, fatigue, GI distress with meals, which is kind of what we've been talking about during this time, hair loss, brittle nails, autoimmune issues. So a lot of potential clinical outcomes that feel more relevant there. So what are other causes? It's like, well, it might not be stomach acid. It could be too low stomach acid, or, how do you know? What are other causes of discomfort after you eat? Because not everybody fits into this box of acid, wrong location. Is it reflux? Is it not? There are other suspects. Frequently, next on the list by my book is food intolerances. That's something you can discuss with your clinician, because we can test for that. It's not easy to test for stomach acid. We don't do that at the Maxwell Clinic because that's usually, well, let me back that up. We do that in a different way, which I'll talk about later, but technically manometry, which is done by a gastroenterologist, where they put a probe down to measure the pH in the esophagus. It's invasive. It's not commonly done, even in GI circles. Textbook wise, though, that's how that happens. But food intolerances can be checked for, so that may be something worth discussing with your clinician. Enzyme deficiencies that could be related due to low stomach acid. Maybe you didn't get the signal to turn on those other enzymes, and maybe those enzymes, due to stress or aging or autoimmune conditions, are low. Going to make it hard to absorb those broken down molecules. Pancreatic insufficiency, gallbladder dysfunction or absence, like we discussed. SIBO, which is small intestinal bacterial overgrowth, and SIFO, which is small intestinal fungal overgrowth. Yes, that could be a cause of symptoms, but it could also be a result of the low stomach acid. Inflammatory bowel disease like Crohn's or ulcerative colitis can cause symptoms. Peptic ulcer disease, and just imbalance of gut flora. So these are things we're not going into in depth today, because they all could be a talk in and of themselves, but I just wanted to touch on them because they can be teased out with a couple of different techniques with your clinician. Okay, so what do? If you feel like you've got too much stomach acid or it's in the wrong place or you're just not sure and you're trying to come off of your uh, Pepsid or Prilosec or you just want to try something more natural? This is something that we use a lot of in the office. It's called Tum EZ and it's zinc uh, carnosine complex and it's elemental zinc and it really does help um, in the moment. You take it sort of as needed and it safely and effectively supports the stomach's natural cell protective mechanisms without interfering with the normal digestive process. Um, those are capsules, so those are easier to take. This one's not as easy to take because it won't, I mean, I guess if you had a big purse, you could put it in there or you could put it on your desk at work. Not as easy to take, but works like a charm. This is a powder. And so you do mix it with water. If you do not like the taste of licorice, you are not going to like the taste of this, but it works marvelously. And you can just do it like a shot. And it has, a concentrated form of licorice and some other ingredients like aloe and arabidoglycans, and it helps naturally soothe and heal the esophagus and the stomach without significantly lowering stomach acid. It is sort of it has a little bit of a well, it has a lot of a licorice taste. So just letting you know, it works great, but it's not going to be something that you enjoy. It's medicinal. And we use both of those in combination sometimes. Some people, one works better for the other, and you just have to individualize there. This is earlier when I said we don't test for low stomach acid in the office, we don't do something to you to test, like we don't do manometry, obviously. But this is something that is frequently used in functional medicine to sort of test the theory of maybe you have low stomach acid and it's not too much stomach acid. And this is called gastric acid, and it is a combination of products, mostly betaine hydrochloric acid, which is what we talked about, pepsin and L-glutamic acid, and some it helps with digestion in that it's sort of a replacer for stomach acid that you may be missing. And you test yourself by starting out taking one capsule with each meal. And if that doesn't help, then you go up to 2. And if that doesn't help, you go up to 3. And you're looking for a warm sensation in your tummy. If you get the warm sensation, then you've exceeded, or maybe with one pill, that's not your problem and you need to look at other things. But the warm sensation in your tummy could indicate that you have reached your dose and you need to back off a little bit. So say you do this and you go up to 4 capsules with your meal and that you get the warm sensation. So you back off to 3 where you didn't have the warm sensation, but that's your dose. And you continue that as with meals as you eat to help lower those symptoms. And that is frequently helpful. Another thing that is frequently helpful, and I don't recommend that you just get this off the shelf and try this yourself. I do recommend that you discuss it with your clinician. It's not that it's dangerous, really, really benign, but it's worth a complete understanding of how to do this in a stepwise fashion and how to use it, just for a short period of time. And some people need it longer. Another thing that I would show is digestive enzymes, which are available in Digestive NRG, and it works in a wide pH range. So even if you don't have too low stomach acid, or if acid's not your problem and you feel like maybe it may be a pancreatic insufficiency, again, something to work with your provider on, but this is another potential aid in helping kind of tease out what's going on. A lot of people get a lot of relief with this. Okay, so I have said a lot of things about a lot of things, and you've had an anatomy lesson about the gastrointestinal tract. So at this point, I'm going to open it up to any questions you may have. And if you do have questions, just put them in the chat bar, and I will find that. Hold on, let's see. in the Q&A. And I'll just wait for a second to let any of those come through, or you may just have follow-up questions for your clinician at your next visit, and that would be completely appropriate. But the big takeaways that I want people to walk away with from today is that it's not that you have too much stomach acid. It's that the stomach acid is not supposed to be in your esophagus. And it may be that your stomach acid is actually too low. And if you are continually lowering your stomach acid, it will cause nutritional problems. And you don't want those. You don't want to add to what's going on, but you don't want to be miserable. So we do occasionally try to lower stomach acid if somebody has erosive esophagitis or something. You've got to get repair happening. But it's not a long-term plan, as the advertisers would have you believe. So, okay, I don't see any questions coming in. So thank you for spending a little bit of your afternoon with me today. And I hope all your meals are just delicious and not painful, and that you can absorb all of those good nutrients. Have a good rest of the day. Thank you for your time.